Was there ever an instance where, I call it imposter syndrome,
Yes.
where you ever sit in a room or an environment and it's like a small feeling where you're like, do I really belong here?
I think we all feel that in different scenarios through our lives. And you always have that moment where you think, can I really do this? But then I always take myself back as to, it didn't happen just for no reason. I knew there was a reason and a purpose why. It felt like a calling on my life that I had to go and study to become a doctor and then to pursue plastic surgery in the end. I sit down and we identify what areas are you concerned about? What is your main concern? And then we have to translate that into, is this something that I can better, that I can beautify without placing your life at risk? Because everything that I do is going to be for your safety. And I'm very, I would say, strict about that. And even if I have to get my dietitian involved, if we get a psychologist involved, if we get someone else involved to help you and manage you as a multidisciplinary team, to put you in the right frame of mind, to say that, yes, you're going to have almost life-altering surgery, having a mommy makeover, you need to be mentally ready and prepared. You need to have support at home. You need to know what you're letting yourself in for.
Sanbonani, hello, hi, and welcome to the Top Women Podcast, a show where we look at the powerful women who have paved the paths for others and what they did to achieve the success that they have today. Today I'm in Richards Bay, but believe me, it feels like we in the area code 90210 in Beverly Hills, which makes sense because of the practitioner that we are going to be talking to. Today we meet up with a beautiful lady who's looking ravishing and definitely fits the part of what her work does. It's Dr. Mariette Mouton, who is a plastic and reconstructive surgeon. I want to find out more about it, what it does, and more importantly, what it takes to make the cut. Dr. M, how are you today?
I'm well, how are you?
I'm good. So, Dr. M, take me back to being raised and born in Upington. How was that like? How was the environment? How was the family?
So I grew up in a small town called Upington in the Northern Cape. My family, we were just a normal middle-class family. I was the middle child. I always had a passion for learning. I call myself a nerd on the inside. So I love learning. I love books. I always used to read. I loved excelling at school. And the idea was that I was always thinking that I would go towards something like accounting, books. I was good with numbers. And then something happened. I had a scar, which was a result of an operation that I needed to have when I was quite young. I was 12 years old. And this caused me a lot of anxiety. I was feeling down about myself. I was feeling self-conscious about the scar. So at the age of 17, my mom took me to a visiting plastic surgeon. So, I mean, back in those days, you only had general practitioners doing everything in town. So we had this opportunity where a doctor came from Cape Town just for a visit to come and do consultations and then possibly an operation. So I wanted him to fix the scar. I thought he was going to take it away. And I sat in front of him and he told me, I can cut that scar and I can make it smaller, but it will never go away. You have to accept yourself for who you are with your scar. And I was like, wow. Nobody's ever told me that. It's like, he literally it was almost like a relief that came over me. It's like, it's okay to have a scar. It's fine. And he made me feel better about myself almost immediately. And I was like, I want to do what you do. You make people feel better about themselves. So that's where the seed was planted to go into plastic and reconstructive surgery.
That is, if one story, I've heard a lot of seed stories. I call them seed stories.
That's what it is.
And this is the most beautiful one. Because more than anything, it's not born from, yes, there's an element of sadness, but there's an element of of rejuvenation
Yes.
in it.
Yes.
So I want to take a few steps back. You growing up in Upington, how was the area? Because I'm thinking, because we in Richards Bay, and
Yes.
you're the first plastic surgeon I have
Yes.
ever met. So
Yes.
the time when your mom takes you to that, how is the overall environment in the area?
So it was a very small town at that stage. It has grown and it has boomed quite a bit right now. Most of my friends, all our parents were teachers. They were all middle class families. You go to school, you either become a nurse or you become a teacher. That was kind of the idea. Even in my family, my parents went to college and they got training, but nobody has ever gone to university.
Okay.
So I was also the first one in my family. My sister went ahead of me. She first went to university, then I went to university. So it's almost like we were like the front runners for education in our family.
So now with that burden, it's a heavy
Yes.
heavy burden to carry. You get to Stellenbosch,
Yes.
and you're coming from Upington, and I'd like to believe Stellenbosch is just like the name posh. Was there ever an instance where, I call it imposter syndrome,
Yes.
where you ever sit in a room or an environment and it's like a small feeling where you're like, do I really belong here? Is it, now moving from that small town to the University of Stellenbosch, did you ever feel, I don't want to say fear, but just that little needling thing at you?
Yes. So, I mean, obviously going in from a small town, my parents drove me all the way to Stellenbosch, the medical campus. We were the first group with a medical campus. We had to stay on res in Tygerberg, which is like a little bit away from Stellenbosch. And now you're first year medical student, the first time you're living in res, you're alone without your parents, you have to make new friends. It was quite daunting. And the backstory to how I got to Stellenbosch, there's another story there.
I love it. I want to hear it.
So while I was applying for what am I going to do for the rest of my life, I put down accounting and I put down medicine. And I only applied to Stellenbosch and I think Bloemfontein. For medicine, all the rest, I put accounting. And I put it almost like as the second option down. And then I prayed about it and I said, Lord, give me a sign that this is what you want me to do. Because there was a lot of people that said, are you sure you want to do medicine? It's very hard. You can't have a family. You're going to have to do community service. They can send you anywhere. Are you sure? And I was like, I'll pray about it. And then I got a letter in the mail. It was the September before the final exams. And it was a letter from Stellenbosch University. You've been accepted into medicine and you're getting a bursary.
Oh, on top of that.
The first year's tuition.
Oh my.
And I was like, well, this is not a sign. Then I don't know.
Yeah.
So that's how I ended up going to Stellenbosch. My sister had gone ahead of me. She went to study like 2 years ahead of me at Stellenbosch. But she didn't have a good experience. Because of the culture, it was just a big shock to her. And I actually never wanted to go to Stellenbosch just because of her experience. And then I got this letter and I was like, oh, well, now I'll just have to suck it up. And I have to go through. So that's how I got to Stellenbosch. When you're saying that feeling of do you belong, I think we all feel that in different scenarios through our lives. And you'll always have that moment where you think, can I really do this? But then I always take myself back as to, it didn't happen just for no reason. I knew there was a reason and a purpose why. It felt like a calling on my life that I had to go and study to become a doctor and then to pursue plastic surgery in the end. And I just put my head down and I said, I'm here to study, I'm here to work. Because what I found is when you're trying to look at the end goal, you get lost. So I try to do short-term goals. I need to get through this one. I need to get through the second year, third year, and you take it one step at a time.
I love the because I think we sometimes get lost in that where you think so long-term that you forget, and this gets so muddled up that you never get to that. Now, with that same mindset in question, now you've been in the private and government sector for almost 15 years before you entered into plastic surgery specifically. Was there any parts during that time where you like, I can't do this?
Yes.
And how did you overcome that?
So I did my internship community service at Kimberley Hospital. My community service here was quite intense because I had entered into it with the idea of specializing immediately into surgery or plastic surgery. I had spent that year in ICU, trauma, and general surgery. I got to a point towards the end of that year where I was completely burnt out. I was standing in a theater room at 4 a.m. while we were busy operating on a patient, and I was like, why am I doing this? Other people are in bed, they're sleeping. I'm standing here operating on someone. I also want to have a life. And in that time as well, people were telling me it's going to take you 7, 8, 9, 10 years to get to plastic surgery. Are you sure you want to do it? Because it's a very long road. At that point, I actually decided, you know what, I'm not going to pursue surgery. I want to enjoy my life. I then applied to go and work on a cruise ship. It's the Royal Caribbean Cruise Lines. They're based out of Miami. And I applied, I got accepted. The next year, I was booked to go onto the cruise ship, and you know what happened? I was in a car accident. So that I had severe injuries, so that put me back 6 months. And at the end of that 6 months, when the doctor cleared me for traveling, people again was asking me, are you sure you want to do this? I said, well, I want to go and travel the world. I want to live my life. I want to see what's out there. And then when I'm ready, I'll come back and I will pursue this career dream that I have. And that's exactly what I did. I went to work on the cruise liners for just over 2 years, and I enjoyed every moment of it. It was hard because it's hard work, but I got to travel and I made great friends while traveling. At the end of the 2 years, I was like, I'm ready to come home. I'm tired of living out of a suitcase. Let me come back. That's when I moved to Cape Town, and I worked in private, then got back into government, and then slowly I was like, okay, I didn't do any overtime. I just worked in the clinic 8 to 4, and then I was like, I'm ready for more. Then I started doing calls, and then I was like, okay, I'm ready for more. There's something missing. And the only joy I had while working in a primary healthcare clinic was when I got to cut out small little things in the rooms. And I was like, you know what? It's still there. The passion is still there. I then met my now husband. He was in Johannesburg. And again, I prayed about it and I said, I'm now happy. I've done primary healthcare, I've done GP work, I've traveled, I've done everything. I think I'm ready now for the next step, to go back into surgery. I applied for a job in Cape Town. I didn't get accepted. I sent my CV to a hospital in Johannesburg. I actually applied for emergency medicine. And they told me, no, sorry, we don't have a job. Then I got a call from the general surgeon at Tambo Memorial Hospital in Johannesburg. And he's like, hi, doc, I got your CV. I was like, how did you get my CV? I didn't even know. You sent it through, I sent it to someone else. And he got my CV and he called me for an interview and I got the job. And like I can tell you that I didn't go and look for surgery. It found you. It found me. So that's why I say, like, what I'm doing, it's not out of my own. Like, I was called to do this and doors would just open where you need to be at that right season. And that's how I got back into general surgery. And from there, wow, it was a roller coaster of work and long hours and sacrifices. And I did general surgery. I actually specialized in general surgery for 3 years. In that time, I had then applied for plastics. There was no post available. I worked another year in general surgery. Then again, I got a call. I had dropped my CV off a year ago. Then while I was on maternity leave, because I said I can't wait till I'm done for babies. So I had my daughter. And while on maternity leave, I got a call to say, we are interviewing for a plastic surgery post. Are you interested? I said, yes, of course. I've been waiting for over a year to get called for an interview. I went for the interview and I was successful. I started my training when my daughter was 5 months old. So again, I tell you, I did not go and look. I didn't even know they were interviewing.
You literally...
I had dropped my CV off a year before that. And
you are what I call a product of divine intervention. You know, and I think that is inspiring for a lot of people, because I always call it like having two little angels, the good and the bad. And sometimes the self-doubt is the bad angel, and it makes you rush things. You know, it makes you do wrong decisions out of fear. Yes. And I think with you, you've got the beauty of that divine intervention. And it takes confidence and strength. Yes. Because another person would get a call and be like, where did you get my CV? Why is this? Yes. I'm not doing this. But the fact that the moment you get a call and you jump at that opportunity tells of your great strength. So I want to find out, now in 2023, you had Wits and you completed. Yes. And I feel like you sacrificed a lot pursuing plastic surgery. Is there any regrets from the years lost? And is there anything you'd have done differently?
I wouldn't say I would have done anything differently, because the situation was I had started plastic surgery when my daughter was quite young. So I missed out a lot on family time with her and my husband because of the hours, weekends. You always had to work, and then COVID hit us and then couldn't go out. So it was, through the training, it was quite intense. What I regret is that the environment that I worked in, at some instances and some points, it was quite toxic. So even though it was great that I had gone through that and I've trained and I've worked, but it came at a cost for my mental health because of the environment and also the impact it had on my family.
Now, I want to fast forward. You are in Joburg at that time working. And then you take the leap of faith and come to Richards Bay. Yes. You know, typically a person would not assume you'd move from Richards Bay to Joburg, and not the other way around. How did that leap take place?
It also came with a backstory. So at the end of my time, my contract had ended with Wits and with the hospital. And I had asked them for another contract or another extension. And they said, no, there's no post available at that time. So there's no post in government. And in my mind, I didn't pursue plastic and reconstructive surgery per se for the aesthetic part of it. No, I pursued it for the reconstructive part. Burns, clefts, congenital abnormalities. That was my passion, and I actually wanted to stay on doing that, but then that door closed. So I was left in a situation where I was like, again, the world is my oyster. I can decide where we want to go. My husband's family is from KZN.
Oh, okay.
And we then decided we wanted to be closer to family. So this is now, work has done its course. I've done working all that hours. Now it's time to focus on family. And I want my daughter to grow up with her cousins and around family. And that's how Richards Bay came up. We knew that the area around Durban North and Ballito and Mhlanga is quite saturated with plastic surgeons. And my heart has never been to pursue money. I didn't do this for the money. Okay, so I said, well, small town, Richards Bay, it's quite close to the family, and a friend of mine actually phoned the hospital manager at Mariette and asked him, aren't you guys interested in getting a plastic surgeon here? And he arranged a meeting. We flew down, my husband and my daughter, came to look at the hospital, we looked at the town, and then we said yes.
You can take the
We'll,
leap of
we'll
faith.
take the leap of faith. It was a big leap of faith.
It was. Yeah.
But after 1 year of being here, I was like,
Am I sure?
am I sure?
Am I sure
There's
about
still
this?
days when
Yeah.
I'm asking, am I sure?
And so it's on that, and I think that's why I want to tap into it, because sometimes people feel like it's wrong once you make a decision. They think that it's not negativity, but it's just that, see, like, are you sure? Like, are you continuing with this? Because I can imagine, listen, Joburg is a hub.
Yes.
You know, it is like everybody. Also, another thing, I think with what your field is, did you not experience this thing where you need to teach people what you do?
Yes.
You know? Whereas I think in Joburg, everybody
knows. Yes, everybody knows what a plastic surgeon does. So it took a long time. I think it took me about a year and a half to, even now, people still don't know I'm here, number one, and they don't know what I do or what I can do. So it took a long time. With the help of the marketing team here at Melamed, I went around through the whole of Zululand. I visited the local GPs to tell them about myself and my services and what I do, which is also quite out of the norm for a plastic surgeon. Because most plastic surgeons, you open your practice and
People
patient
come
to you. Where in this region, this service hasn't been here before. People are so used to taking a drive down to Durban. And now there's someone that's right here. But it takes a long time to build trust. And people want to know, but can you trust this person? We've never heard of her before. And that's why I focus a lot on reconstructive surgery at the moment. And I love what I do. And so far, my patients are happy. And my referrals currently are word of mouth referrals. So I was like, oh, so how did you know? A friend of mine, you operated on this one and that one, and they told me about you. And I decided, no, I'm not driving to Durban. I'm coming here.
That is beautiful. I think that now goes back to who you are as a person, where you do have that aura. As I'm sitting across from you, it's engaging. I'm drawn to every single word. And I think that reflects to the fact that I have not seen crazy social media ads. I have not crazy, because I think also another thing, as much as I know plastic surgery and reconstructive surgery right now, and let me not even look at the reconstructive, the plastic surgery, it's a big hype, you know, but we don't understand exactly what opportunities are there, you know. So I also love the way you have tackled it, where you went to the doctors, where it's word of mouth, and it's not some crazy flashy social media thing where come in, you lose 150 pounds in 2 seconds, kind of, you know. And I think that's why it creates this relationship that I can trust you and come to you and put my faith in you, you know. And with that said, I want to find out from you. It's often said that medicine is a jealous mistress. How have you been able to tame her and still maintain a healthy family life?
It is hard. It is hard to do both, because like I previously told you, that you have to work as if you don't have a family, and you have to be a mother and a family and a wife and run your family as if there is no job. And it's quite hard. It takes a lot of hard work and dedication, but you have to put boundaries. You have to put your boundaries down and say, this is when I'm at work, I'm at work. I'm a surgeon. And then once I leave here, I cut off and I put my priorities into my family. So for me right now, my family is my priority. The business is there. I would love to work more, work longer hours, study, but then I ask myself, what am I chasing? What is it when I die? What is it that I want people to know about me? Oh, she was always at work. No. I want my daughter to know that she has a mother that loved her, that cared for her. And my husband to know that he had support. So I love what I do, but I'm never going to put that above my family. I think you need to get your priorities straight when you do that.
I want to ask you a controversial question. Let's spill the tea. But let's be honest now. I want to take away from the reconstructive, because that is what you spoke about the clefts, you spoke about injuries and stuff like that. I want to tap into the plastic surgeon side of things, and where society would call it vain. We'll talk about changing, altering people's appearances and stuff like that. And to you as the surgeon, as the person behind the knife, what would you say about that misconception that a person that's going to go for these procedures, either they're vain or they're not happy with themselves and stuff like that?
For me, doing plastic surgery is not about vanity. It's about restoring dignity. It's about giving, especially women, the opportunity to feel like themselves again. To know that, yes, there's an outer appearance that we are working on, but I also focus on what's going on the inside. And for them to know that they matter, their life matter, and I want what I do to translate into their whole being. So what I do is not just to make you look like someone that you are not, but to be very focused on who are you and what are we trying to achieve. We want you to make you look like a younger version of yourself, not unnatural, and to follow trends. So I'm not really on the...
You do the the cat eye, the
no,
fox.
I don't.
Yeah.
So I have declined patients that has to ask me for things, and unfortunately for me, I tell them, I politely decline that I will not give you cat eyes because that is not the aesthetic and that is not what I want to put out to the world. So you are free to find another surgeon.
I love that, because more than anything, I think, and this is not just with surgery or plastic surgery, but I think it's society as a whole, is that we are living in a society of trends.
Yes.
And I think so, especially like I say, when you think plastic surgery, people think BBLs, they think the rhinoplasty, but the extreme one, you know, those cat eyes. We know the names, you know, and I appreciate the fact that, because I think even like you say, politely decline, but you have a conversation and explaining it to them. Because somebody will see a celebrity in the US doing it, but not understanding that it's not just a once-off thing. You're going to have to, there's repercussions to that and all of that. So I want to find out. So I know with you, giving back is like a core to the philosophy and everything that you do. And I want to just take a pause from the plastic surgery into the reconstructive element of it. Have you ever worked on someone and afterwards you felt like you gave them their life back? Or is there one story when you remember that I've changed this person's life?
I think I have quite a few of those, and it's hard to pinpoint
just the one.
Just the one. I've done burns reconstructive work that was quite intense, but a most recent one, I don't think, it doesn't really, for me it falls under reconstructive surgery. So I do a lot of breast reconstruction, and I do breast reductions. I had a lady, she was 52 years old, and she was struggling with large breasts since the age of 19. And she's always was self-conscious, always wasn't happy, and she carried this weight on her chest. And I see that as a functional surgery and not as a cosmetic surgery. And when she came to me, I told her, listen, you actually need to lose 10 kilos before you are fit for surgery. And I asked her, do you want to go to the dietitian? She said, no, I'll do it on my own. 3 months later, she walked in and I couldn't believe it. She had lost more than 10 kilos. We had gone and I did her surgery and it was life-changing for her. Like her whole life changed. And she was so scared because she's like, I'm 52 and people ask me, why do you want to have it done now? She's like, I cannot live with the pain anymore. I need to have something done. And like to think that she had struggled her whole life.
Basically.
Her whole life, basically.
From 90, you're still a baby.
Yes.
Yeah.
And now finally at the age of
52. I'm saddened but happy that we have people like you who give those options, because I think that's one, and I spoke to you before this sit down, is that people think it's a trend right now, especially with the breast reductions and breast lifts. But I'm empowered by the fact that you as a woman are giving back to these women, because I love the fact that you say it's a functional, because I'm a mom.
Yes.
My body has changed.
Yes.
You know, and at the same time, society will tease you for that. They'll say, oh,
Yes.
you know, so there's certain clothes you can't wear anymore. I'm just 30, but already I feel the need to dress up more, to clothe myself more. You do lose your confidence a bit, and society doesn't make us meet people like you and say there is an option.
Yeah.
You know, you're getting people who say like, I'd rather not have a child because the changes are going to happen. You're getting people now who are doing, I don't want to say illegal practices, but practices that are not normal, just to try and get that elasticity back. So what would you say to a growing generation of women now who are actually, it's not like our parents back then who did have the option, it's there, but they have an option of talking to people like you, having a consultation, but also that wisdom of saying when do you know when it's practical, it's functional, and it's vanity.
I always tell ladies, please come for a consultation. I sit down and we identify what areas are you concerned about? What is your main concern? And then we have to translate that into, is this something that I can better, that I can beautify without placing your life at risk? Because everything that I do is going to be for your safety. And I'm very, I would say, strict about that. And even if I have to get my dietitian involved, if we get a psychologist involved, if we get someone else involved to help you and manage you as a multidisciplinary team, to put you in the right frame of mind, to say that, yes, you're going to have almost life-altering surgery. Having a mommy makeover, you need to be mentally ready and prepared. You need to have support at home. You need to know what you're letting yourself in for. Even just normal your breast surgery, and that you need to know what you're letting yourself in for. So that if anything happens down the road, you can't turn around and say, oh, but I never should have done that. You can say, despite everything, this is what I wanted to do, and I'm happy that I did it, and I'm happy with my results. So I always tell them, even if you just have questions, even if you're not ready for surgery, a lot of my ladies, they go away and a couple of months later they come back and they say, I've thought about it and now I'm ready. And also they saved up some money.
That's so important. But on that note, I feel like I mentioned the office space we're in. By the way, this is a surgery. This is not hideout. This is where Dr. M works. But you are in the aesthetics field, you know, and we know many doctors will tell you about self-care practices that they themselves don't practice. Do you have a routine or like a self-care pattern that you do, that you bet on, that you'd like to tell our viewers at home about?
Self-care is very important, but this is the part where my husband will laugh and say, but what are you doing? So it is quite hard running a business and being a mom and in the family, but you have to prioritize yourself. You have to make sure that your skincare is in order, that what you're eating is in order, your movement and your exercise or whatever form you use is there to have a balanced life. So it's very hard for me at the moment. I'm not hitting the gym like I want to,
but you're getting there.
I'm getting there.
So a last one. I just want to find out from you. I wish we could sit like this the whole day. I think the more the intrigue of everything else is that I was born and raised in Upington, and I've been here for the longest time. And like I said to you, this is the first time I am meeting a plastic surgeon, you know, and it's definitely not what I expected.
Most people are surprised when they meet me.
You know? So you expect, like I say, it's vain, it's vicious, it's, you know, maybe they'll, I don't want to say block you down, but kind of destroy you so that they can build that confidence themselves in a sense like that. And you've worked so hard and you've been a mom. And I just want to have two questions for you. The first one, how important is it being fierce and being a boss? Because you're an entrepreneur first and foremost, you know, being an entrepreneur and being soft, you know, because I think society has taken it away from us that we are to be soft.
It's very hard because in our society, to earn respect as a woman and as a surgeon is quite different than my male counterparts. It's much easier for them to walk in, and just because of the fact that they're male and they're a surgeon, people already respect them.
Even more.
But as a female, it's like you have to prove yourself. You have to prove that actually I am just as good or even better than someone else. So it is quite hard. So you have to be confident and you have to be fierce in certain situations. But because I am very down to earth person, I show emotion, I show empathy, I show compassion and kindness. I can't take that away. That is inherently who I am. So that always shines through. But sometimes people mistake your kindness and compassion for weakness, and they like to take advantage of that. So it's also to be awake and wise and to realize if people are trying to push their agendas on you. So you have to be alert and always, not always, but ask yourself, what are the intentions? When they approach you with a business idea or something that I want you to do or get involved in, what is that they want to get out of it? Because sometimes people would want to use you for their own gain. So it's quite hard.
It's tricky. And then my last question for the day, Dr. M. I want you, let's take a little trip in our imagination. You are now 80 years old. You're now 80 years old. You're sitting on the porch. You got your grandbabies. Your husband has a cup of hot chocolate on the other side with this newspaper, and you're on a rocking chair on the porch, and it's the sunset, and you're thinking of you now. What would you like to have achieved by that age of 80? And you look back and you said, I am so glad I did this and that and that. And lastly, something that you tell you now to continue the fight and path that you're on.
I think for me, the most important thing is that don't lose who you are. Remember who you are, where you came from. And for me, very important, to stay within the will of God. Because He brought me here. He gave me this opportunity to be here and to seek Him in everything that I do. Because it's not out of my own that I'm here. So when I reach the end of my life, I mustn't look back and say that I lost my way, that I was starting to chase fame and money and recognition, because it's not about that. Because when we leave here, we go with nothing. Okay, the only thing that you can leave behind is your memories for the people that you love,
yes.
and that know you. And I want them to remember me as somebody that showed compassion, that showed empathy, that lived to better other people's lives, and that wasn't in it for their own gain. So even now, it would be something that I tell myself to focus on what is important. Why are you here, and what do you want to do for the rest of your life, and what do you want people to remember you for? So that's what I want to say.
That is a memory and a half, and I hope I can meet Dr. M at 80. Dr. M, thank you so much for sitting down with me today and just having this chit chat and being so open about your field and how you grew up. I know and I believe that tons and women and young men and boys actually are inspired by you and all that you do. And may your business flourish.
Thank you.
And may God's favor and faith be over you.
Thank you so much. It was lovely to chat to you. And you know where I am now.
I'm coming in for a little consult. Ladies and gentlemen, that was Dr. M, who is changing the world one slice at a time. And one thing I know for sure, I better get my coins right, because I am going to be visiting her. Not only does she change and no, let's not get it wrong. She doesn't change your appearance. She just brings out the best version of yourself. My name is Zama King McClure, driven by Mid-Bay Waters, and this is the Top Woman Podcast. Like, follow, and subscribe.